Hammer toes or tight arches? What horrendous looking things. Hi, I'm Dr. Justin Lin, chronic pain physical therapist at Rehab and Revive. We've got the answer for you to improve your predicament coming right up. But first, please spend a few seconds to like our video, subscribe to our channel. If you found this video helpful in any way, please consider hitting the thanks button and donating. Also, our team has worked hard to bring online exercise programs to you. You can find the link to our Revive at Home programs below in the description box. We appreciate your support. So why does this happen? The functional cause of hammer toes rests in the need for the tendons to grip the ground constantly. Therefore, the tendons are shortened over time. Tight Achilles and toe walkers generally need to grip the ground more consciously or unconsciously so they can vault over their tight feet and ankles to push off for their gait. You may notice gripping of the toes over time while one stands, sits, or walks. I'll swear this until the day I die. What we wear on our feet and how we move in it is the reason for almost all our foot and ankle issues. You'll also notice that a lot of times you have high arches and that accompanies the hammer toes. A good foot mechanic is to allow for splaying and spreading of those toes. So let's get to it. All you need is a handy dandy golf ball. And if this was my feet, you're gonna press your foot and find the tightest spot. And what you're gonna do after that is you're gonna try to lengthen and spread. You can put your body weight and the pressure as much as you want, as much as you can tolerate, and keep spreading. So you're trying to spread your foot out and open, out and open. And we'll show you this on my actual foot, but press down. What you'll notice a lot of the times for all of you out there is that when you press down, you really can't even move it when you're on that restriction. So you want to keep doing that till it frees up, and then you'll be a happy person. All right, we're back. Like I said, all you need is a golf ball. We're gonna actually do this on my feet. Typically, I would do this on sitting on the ground, while I'm sitting and then the ball's on the ground, but just for the purposes of this video, I'm just gonna do it right on the table. So what I'm gonna do is I'm just gonna find whatever the tightest spot is, and usually that's the most tender spot. And what you're gonna try to do is you're gonna try to spread it. And you wanna spread all these toes like up and out, right? So you want to spread, and you're just working on spreading. A lot of times, a lot of you also have that middle arch pain. That high arch usually is accompanied with the hammer toes. You'll see that in correlation a lot of times. So you'll find that somewhere in the middle, that's the spot. And I found a really good spot right here, kind of along where the tendons of the big toe are. And I'm just trying to spread it, and I can load a little bit more, and oh yeah, it's getting that spot really good. So if you believe in Chinese or Eastern medicine, there's a lot of things with the feet having to do, it's getting real tender now as I keep introducing this stretching. And you might not feel anything for the first 30 seconds, but as you do this with load over time, you got gravity, you've got your pressure, that's when it really counts. A lot of you who are in ski boots, snowboard boots, you ice skaters, hockey players really could benefit from this because you're in something that's very tight, or these working boots or factory boots or whatever, these steel-toed boots. There's not a lot of give in these. Recently, one of my patients is a UPS FedEx delivery guy, and he's just saying there's no splaying. So I told him if there's a way to find maybe even a bigger size. But this is how you start working against those hammer toes, those arch pain, those feet pain. After you're done with it, after it starts feeling like nothing, that's when you can move on to the next spot. So you're just spreading your toes and then just really trying to think of that in, this isn't a perfect coordinated system, but I can tell you just from my point of view, these two toes don't really do that much. So I can even just try to actively use my own hands to spread it if I just don't have the coordination in my feet. And that's normal. You can do that. So you're really trying to lengthen these toes up and out, up and out. Good. Yep. and just have fun with this. And really, you just feel like a lot more surface area the moment you put your foot back down, and it's a little bit more control. So that's as easy as it's gonna get. Let us know your thoughts on our video. Leave us some love or questions in the comments box below. Please like and subscribe. We appreciate your support. I'm Dr. Lin. Remember, we heal smarter.